Gastroesophageal reflux disease. The gastroesophageal reflux disease occurs when there is backflow of gastric content into the esophagus. In normal conditions, nothing from the stomach can enter back into the esophagus. This is due to the presence of the lower esophageal sphincter. This sphincter allows food and water to enter into the stomach, but does not allow it to reflux back as it tightens at the lower end of the esophagus, creating adequate pressure to prevent its opening. But sometimes this lower esophageal sphincter may weaken, or the pressure inside the stomach may increase to more than the pressure in lower esophageal sphincter, thus allowing the gastric contents to regurgitate. As we already know, the stomach secretes acid to digest the food. Thus, the refluxed content is acidic in nature, which on contact with the esophageal mucosa irritates it. Now, there are two main causes of this disorder. The first is LES relaxation and the second one is the increased intra-abdominal pressure. A relaxed LES allows the backflow of stomach content into the esophagus, while if the pressure inside the abdomen is more than the pressure in the LES, then it will force open the LES, causing backflow of the stomach content into the esophagus. Some of the common risk factors that causes an increased intra-abdominal pressure are pregnancy, overweight, eating large meals, eating before going to bed, lying flat after eating, and exercises which increases intra-abdominal pressure. Factors that facilitates LES relaxation are smoking, drinking alcohol, drinking caffeinated or carbonated drinks, and certain medications. Eating spicy or fried food can also increase the gastric acid secretion and is considered as a risk factor for gastroesophageal disorder. The first sign and symptom that occurs in gastroesophageal reflux disease is heartburn. It is the burning pain in middle of the chest which occurs due to the reflux of acid. It usually occurs at night time. Regurgitation, that is appearance of the refluxed liquid in the mouth occurs, as well as it also makes the patient nauseated, which may lead to vomiting. There is acidic taste in the mouth and the patient suffers from dysphagia, that is difficulty in swallowing. Dysphagia usually occurs due to esophagitis that occurs with the reflux. The patient also suffers from sore throat and coughing, which usually occurs due to the irritation of the esophageal mucosa. There is a sensation of a lump in throat or behind the breastbone. The patient also suffers from bad breath, which is acidic in nature. The teeth can start wearing away due to the acid that refluxes into the mouth, causing tooth damage. Now let us discuss the complications of GERD. First, esophagitis. Esophagitis is the inflammation of the cells lining the esophagus. It occurs in response to the damage caused by the stomach content that have refluxed. The inflammation tries to neutralize the damaging agent and heal the esophagus. But if it fails to do so, the damage to the lining occurs, causing ulceration. This ulcers further erodes the blood vessels of the esophagus, causing bleeding in the esophagus. This may be exhibited by the presence of black tarry stool, which is the color of the stool due to the digestion of blood. Second, strictures. The ulcers of the esophagus may heal over time, forming scars. These scars causes narrowing of the esophageal lumen and due to the fibrosis have the tendency of blocking the esophagus. The third commonest complications of GERD is Barrett's esophagus. It is the change in the cells lining the esophagus, wherein the esophageal cells are replaced by tissues which are similar to the tissues of the intestinal wall. This is a precancerous condition and requires regular screening to detect cancerous changes. Adult onset asthma. The nerves in the lower esophagus also innervates and stimulates the lungs. These nerves can stimulate pain, coughing, or cause bronchoconstriction, thus causing asthma. The diagnostic tests that are performed to diagnose GERD are esophageal pH monitoring, endoscopy, and manometry. The esophageal pH monitoring assesses and confirms the regurgitation of the reflux material as the reflux from stomach is acidic in nature. The upper GI endoscopy is done to directly visualize the lining of the esophagus and the stomach, thus determining any damage due to the reflux. It is also done to detect Barrett's esophagus in patients who are already diagnosed with GERD and is used as a screening test for determining cancer of the esophagus. In esophageal manometry, a tube will be passed from the nose into the esophagus. It measures the rhythmic muscle contractions of the esophagus during swallowing and also measures the coordination and the force exerted by the muscles of the esophagus. GERD is treated with simple medications and lifestyle modifications and rarely requires surgery. Medications like antacids, H2 receptor blocker, proton pump inhibitor all can help by reducing overall pH of the stomach content and gastric acid secretion. Thus, there is lesser damage to the esophageal lining during reflux. Baclofen is another medication commonly used to treat GERD. It is known to strengthen the lower esophageal sphincter by decreasing the frequency of the relaxation of the lower esophageal sphincter. If the patient requires surgical management for GERD, then there are two common procedures that are followed for treatment of GERD. The first common procedure is fundoplication and the second one is the LINX device. Fundoplication is a common type of surgery done to treat GERD as well as hiatal hernia. In this, the fundal part of the stomach is wrapped around the lower esophageal sphincter to tighten it so as to prevent the reflux. The most common type of fundoplication done is Nissen's fundoplication and Bels's fundoplication, wherein the Nissen fundoplication is a total wrap and Belsy fundoplication is a partial one. The next common procedure done to treat GERD is the use of the LINX device. It is a device which resembles a band made up of metal beads. This band of metal beads are placed around the lower esophageal sphincter like a scrunchie. Thus, this device tightens around the lower esophageal sphincter to keep it closed and prevent reflux. But on the consumption of the food, the device opens with the pressure from the food, thus allowing it to enter the stomach. Lastly, there are certain lifestyle modifications that have to be followed to prevent or reduce the effects of GERD. First, losing weight. It helps decreasing intra-abdominal pressure and thus reducing reflux. Eating small frequent meals also helps by reducing overall amount of food in the stomach at one time, thus preventing reflux. The patient is advised to not lie down immediately after eating and to elevate the head end of the bed during sleep. Quitting smoking is also very beneficial in patients with smoking associated GERD. Alcohol intake must also be reduced to prevent its relaxation effect on the LES. Avoiding spicy or fried foods have been found beneficial for most of the patient to reduce the episodes of reflux. Wearing loose fitting clothes also helps by not putting pressure onto the abdomen, which in turn prevents reflux.